let it simmer. It's what
Fair
happened.
enough. Fair enough. We had big thunderstorms down here. Yesterday was insane.
It's rainy up here now. Yeah.
Okay. Yeah. Well, man, I tell you what, it has been a crazy 3 weeks. I can't believe everything that's happened in the past 3 weeks. When were we even at HFMA? Was that 4 weeks ago? I think that was only 4 weeks ago.
Yeah, it was June 24th.
This is
So
wild.
a month ago. Yeah, about a month exactly.
So we have been super busy.
Yeah.
So I know today we wanted to talk about some of the use cases that we've been seeing.
Yep.
Just within price transparency, specifically within the health plan price transparency data, and looking at all of the contractual rates between the providers and the carriers or the care delivery organizations and the health insurance carriers, whatever nomenclature people want to use these days. There's a
What's
lot
the
of
most common question we get, right? It's like, how are other people using this? There's still a little bit of uncertainty in the space, but that dam is breaking. It seems,
Yes. It's challenging because there's so much that can be done with this information. So I think dam is a good analogy.
Yeah, we learn about new use cases all the time. And it started out, right, where you have the people who can generate a revenue stream based off of this information that will want to go get it first. That's always kind of how things work. If you can monetize it, people will go and figure out how to do that first versus cost savings, benefits analysis, that type of stuff. Like those tend to be a little bit laggard in terms of, hey, are we going to invest a lot of money for something that may be uncertain versus we can invest money and we'll get a return on that because we can develop a revenue stream, right? That's why we see a lot of consulting companies using it, actuarial firms using it, people who are advising health systems doing rate benchmarking, doing underpayments analysis. Are you actually getting paid what your contract says you ought to be getting paid?
Right.
Things like that. These are kind of direct monetary motions that companies can create. So those are the early use cases, but now we've seen dozens and dozens of use cases.
So let's dive into the first ones, because I think that's important, just kind of to go in, just for people who aren't aware of what the most common use cases are. Again, for this information, you named a couple of things: rate benchmarking, contract negotiation. I'm sure everybody can figure that one out. That is simply the, hey, for my peer care delivery organization down the street that looks like me, that has similar demographics to me, that has similar physicians and clinicians wearing my jersey, right? Kind of similar market power. I want to see what they're getting for reimbursement and by billing code. And I want to compare that to what I'm getting. And then I want to negotiate based off of that. The interesting thing is, for everybody that may not be aware or haven't thought about this, is that the insurance carriers are using it the opposite way. And I think that's really big. So everybody pay attention to this. So we've had some of our customers come to us and say, hey, by the way, so-and-so really large insurance company, top 3 in the US health insurance company, has sent an official letter to a hospital saying, hey, we use this information. And based on this information, you're getting 20% more than you should, or we're reimbursing you 20% more than these other insurance carriers for the same services. So guess what? We're going to be reducing that. So it's very interesting, this market pressure and these market dynamics kind of coming the other way, which this was always going to happen. And of course, health insurance carriers are very savvy about their money. I'm not surprised they jumped on this and are maybe being more aggressive than the hospitals and hospital systems in some cases. But, they're saying, hey, this is the published contract information for these other carriers, and they're not reimbursing you as much as we are. So we're going to have an adjustment. So you're really coming to this point where the hospitals and the health systems are either being proactive and being adopters and being very creative about their revenue strategy, their reimbursement strategy, their growth strategy from a services perspective, or they're sitting ducks, and they're going to get this letter and be on their back heels. So that's crazy. What are your thoughts?
The smaller systems that don't maybe have the leverage, the larger systems, everybody we talk to pretty much they have their rates and they have many thousands of lives that they're
Yes.
taking care of, right? So there's kind of a mutually assured destruction type scenario that happens with
Right.
with those providers and the carriers in their regions. But for smaller health systems, this is certainly a concern that it's going to be like, well, either we're going to use this information and at least be able to combat it and say, all right, maybe you looked at this data, but that's not exactly the same. It's not apples to apples. You're not doing the right comparisons. We have carve outs. There's things like that are in our contracts with these other carriers. But if you have no idea and you don't even know that it's going to come at you,
right,
you're going to be on your back heels. And what recourse do you have? You're just going to have to accept it.
Yes. So that's number one. Bidirectional rate negotiation, rate benchmarking. Which is really interesting. So this is a dynamic space that we are in.
Especially the national carriers, they have a lot of resources at their disposal. They do have the ability to get all of this data and analyze it. They have been doing that for the last 2 years since it was released 2 years ago today. 2 years ago at the beginning of this month, right? So
right.
They've been spending that time analyzing this data.
Yes. They've had it since the beginning.
And creating some playbooks of like, okay, here's the health systems, here's the providers, the physician groups, the surgery centers that we're going to go after. And that's what they've been doing. And as part of their fiduciary responsibility to their shareholders and their employees, right? I mean, that they're responsible for making sure they're making the most amount of money and not overpaying for services.
Yep. That's right.
Can hardly blame them.
No, it is the name of the game. And you mentioned something around the large health systems already having all of that market leverage and really having the best rates. And that's absolutely right. But then that leads to use case number 2, which is kind of the second most common and has been really interesting to see. And that is around market expansion. So yes, I am kind of the biggest name on the block. However, I want to diversify my services with clinics, imaging centers, ambulatory surgery centers, etc. within my neighborhood. They've probably already done that. This has already been a trend. But now, hey, I want to go to the next state over. Or hey, I want to go to 4 states over, right? We're seeing hospitals expand, within their region and hop multiple states. I'm going to go from Florida to Tennessee, right? So, or even further, there was a large multi-specialty practice I was talking to that was looking to purchase an organization in California. And obviously, when you're going through negotiation, you can't get the detailed contract information. That's not something that you're going to be able to get within kind of the due diligence process and period. But you could get the actual published rates here. So market intelligence, market expansion, understanding the dynamics within a different market, understanding what the baseline is. Hey, I don't have a relationship with these health insurance carriers, right? From a care delivery org perspective, I don't have a relationship. I don't understand where to even start. And as we know from state to state, these reimbursement rates vary greatly. So you really need to know where to start.
Right. And they have tools at their disposal, right? The black box analysis that they can do where they don't need a ton of information, but you're also not having necessarily the correct inputs. Maybe you get some information here and there, but this data enables you to get the exact right now. It still doesn't contain carve outs and some outliers and things like that we're working to get into this data set from a mandate perspective with CMS. I think we'll talk about that maybe in another session. But
and culturally, that's Yeah, go
It
ahead.
is, but it's still a huge. I mean, there's a huge volume of data, and you can see normal fee schedules, you can see actual negotiated rates, um, and especially on the professional side when you're talking about market expansion for these smaller groups, especially on the professional side, the contracts aren't as complicated, so there's not a lot of uh, carve outs and things like that where you can actually get the correct negotiated rates across these payers, and you can see, hey, this imaging center is getting way more money than we are. You
Yeah,
know, um,
absolutely.
we
And
should
I think
help them up.
change, and it's scary to change your process, but you don't even have to change your process. This is just another really important data set, another really important puzzle piece that you can put into your puzzle of rate negotiation, strategy,
Yeah,
expansion. Like, why would you ignore it, especially when it's very reasonable to get it? Like
yeah. There's a
don't.
number of companies out there that whether you're and it's we kind of all span it's a wide range of different types of services that price transparency companies provide, right? Like you have everybody from people who can provide you with, hey, I just need one provider, one billing code, um, one payer, and
Mhm.
I just need the rate for that code for that provider for that payer, and they'll give it to you. And Hex IQ is one of them. I think they do it for like $6, right?
Right.
So you can go on their website. I think you pay with a credit card. So everything from that to obviously
I need
if
everything ever.
you need a state, that's going to cost you quite a bit, but but everything from we have all the data from every payer, every provider, every billing code,
With
and
historical snapshots
with
so we can
snapshot
see
and
things.
everything in between. And there's companies that have that have the same. So whatever your use case is, totally ignoring this data doesn't seem to make much sense. There's probably a price point that will work for whatever your use case is, or
I'm going
whatever
to
you.
I'm going to pick on healthcare for a second because I've been in and out of it for 20 years, and it seems like there's this cultural hesitation to try new things, and that's why sometimes healthcare benefits a lot from other people and other industries coming in to
Mhm.
healthcare, saying like, "Why does this? Like, what do you do? Like, why does it work this way? Why are you doing it like this?" But
Yeah,
sometimes, if you don't have that perspective and you've been in it so long, you just kind of it's a human, and if it's a human flaw, you just kind of get not even a human flaw. It's a human attribute that you just kind of adjust to the machine and how the machine works. Now, I've had a picking on healthcare. A good friend of mine who used to do Epic implementations for many years, and there was always somebody in that room as they were building out a workflow or a process that would be like, yeah, but this one time somebody came in and presented like this, and and it just kind of blows up the it's like, okay, we're changing, we're doing like an 80% improvement in changing how we're changing how the organization operates based on like 80-90% of the use cases, and creating huge efficiencies. But there are some people that are just so stuck in this, yeah, but what about? And they just can't get in, and they take all the energy and all the momentum and all the excitement, and everybody's like, yeah, I guess it wouldn't work for that one scenario that happened that one time. And I feel like sometimes in healthcare, especially, we're plagued with that. And with this data, to your point earlier, there's a lot of, yeah, but this one time, or what about? That's
right.
not
Like,
the
oh,
point.
this right. There's multiple rates here for this. Why? Why? It's like, okay, but you're going to ignore the 99% of the data that is good
Right.
and useful, and there is some reason that there's two rates for the same service for the same provider. There's some reason, and again, we're working on making sure that people have to define that the carriers have to define
Right.
um, that specific reason. But there's still a huge amount to ignore the whole thing, or to kind of pause and say, oh, let's see what happens.
For a what about? It doesn't make any sense, and it's preventing huge benefit to your organization to worry about these little scenarios. So you're looking at an entire ocean of data, and you're taking a cup of it and saying, it's a little cloudy. I'm not sure. It's just like,
Right. Right.
so,
Best not to die of thirst.
yeah.
Trying to
So,
get the most pure form of water. Right.
yeah. But
So,
to those organizations, and I wish it wasn't true, are going to be first use case sitting ducks. They're going to be sitting ducks when the insurance companies come knocking on the door, send that letter and say, guess what? Y'all are going to be 20-30% down across all of these services that you do. So you just lost tons of revenue. And what are you going to say? Because you haven't been looking at this data. You haven't been understanding this data. You're not going to be able to push back. You don't know. It's too late.
and also just from a pushback on the carriers themselves. I mean, there's only so much that we can do as price transparency companies to put pressure on the payers. But if you're a provider, you see this data, looking at your own data and saying this is wrong. Well, it may be wrong, and you should make sure that the carrier knows that it's wrong, because other carriers are using it to compare you against them. So
Right.
if they have you at rates that are way lower,
Yeah.
you're going to look at that. They're going to look at that and say, "Hey, what? Cigna's paying you 20% less." Be like, well, that's not right.
Yeah.
Publicly available, it has to be right. This is the law. It has to be right. So
Yeah,
now
right.
you don't really have any leg to stand on here, right? So
You don't. So we got through, and I mean, there's a lot of depth to these use cases, but those are the big ones, 1 and 2. I think the other ones that are interesting, and maybe we can dive into some of the unique ones that we're learning about. But the other one that was interesting and that we're seeing is that underpayments analysis, or claim filling gaps in claims, basically using this contractual information as a backstop to an already existing revenue cycle process. And I think that's really cool as well. There's a lot of automation. Repricing companies can use it. Revenue cycle teams can use it to automate the analysis of underpayments, to catch things faster, to put that into their process so they can catch gaps in revenue faster and address them more quickly, which gets cash in the door faster. So that's huge. Yeah. Now, and I guess I want to wrap up the use case conversation, since I picked on healthcare culture for a little bit, which I'm not taking back. So it's my opinion, and I'm not taking it back. But open to changing it if I have more information. But I've got a large sample there. I will say one thing that would challenge my picking on healthcare as not being great at changing their ways and adopting new processes and new data sets is a presentation that we heard at the HFMA annual conference. Really great conference that we were at. Times I don't understand flying so fast. It was only 4 weeks ago. And I want to do a shout out to UofL Health in Kentucky and their presentation, because they're the opposite of everything I was just picking on. They figured out how to parse this data, tried to get something for, I believe it was Anthem, Alabama Anthem, went and tried to get a file. It's like, holy crap, it just blew up my computer. Worked with IT, got servers, wrote the Python, parsed the data, brought it into their negotiation, had a cross-functional team working on it, and was able to get, I think, across like 20 DRGs, huge reimbursement increases that are going to, over this next year, all things being the same, volume, case mix, etc., be a gigantic revenue wiggle and EBITDA wiggle. I think he mentioned like a 3%, 4% forecasted improvement based off of just these changes across DRGs and other key services. So yeah, Jerry, you were in that presentation. What are your thoughts on that one?
Yeah, that was definitely very interesting. It just goes to show that it's not always a matter of, oh, you're getting ripped off. It's a matter of, in some cases, just having the knowledge and awareness and saying, hey, maybe in our last negotiation we just didn't know enough about the market that we're in, about the demographics that we're in. where these procedures are actually worth more. And it's hard because it's to do a cost analysis on healthcare. It sort of a dangerous, slippery slope. I think that a lot of people don't want to go down. Well, what does it actually cost us? Well, it's hard to know. You have to understand volumes, and there's a lot of pieces to that puzzle. But with this data, I think we can, over time, at least get to a fair price for a given demographic, a given market, a given provider type, given specialties, things like that, with a lot less permutations and a lot less variability. But for what they did, they were able to. They can't pull all the thousands of files, but they didn't need to. They needed to pull, one file, a couple files that had their information in it. And they didn't need to look at every code. They just needed to look at some specific high volume codes. And by filtering and filtering and filtering, they're able to get to something that was useful. And so at the very least, you don't have to buy the data, but at the very least, you could probably get your technology team to take a look at it. And see if there's any opportunities. Again, it's not about getting ripped off. Sometimes, you're negotiating thousands of codes, especially as a large health system. You're not always going to catch everything, and to do things in in aggregate can be challenging. So, that was a great presentation, and hopefully more systems are at least thinking about like, oh, all right, this data can be useful, and 3-4%. That's not a small amount on volumes that you're talking about there in the many millions of dollars.
Yep. And all that, passing that down into patient care, improving margins, and having a system that operates the right way with the patient at the center. I look forward to that day, and I look forward to your point, to the day of fair pricing. And we're going to get there together with all of the price transparency organizations that are working hard and diligently to expose this information, educate, and support people. So I guess our message, wrapping this up, we talked about the three big use cases, talked about a great leader showing the way at the HFMA conference, UofL Health. And yes, our lasting words: don't be afraid. Don't be a sitting duck either. Go get help. Do it internally. Do it externally with a vendor, but start getting prepared now, and because the carriers are going to be knocking on your doors pretty soon, and this is going to be a normal thing pretty soon. So it's time to get started, and we're excited. I'm excited to hear about other successful use cases that we can share with everybody.
Sounds good.
Thanks, Jared.
Until next time.
See y'all.
See ya.